If you've been told the key to lowering your blood pressure is simply eating less salt, you may be missing the real problem. In fact, many people cut back on salt for months, do everything they're told, and still watch their blood pressure stay stubbornly high. That can be frustrating, confusing, and honestly a little scary. The truth is, salt is only one piece of the puzzle. For many adults, over 60, the real drivers of high blood pressure have nothing to do with the salt shaker sitting on the kitchen table. Hidden nutrient deficiencies, high insulin levels, poor kidney function, and other overlooked factors may be pushing your blood pressure higher every single day without you realizing it. The good news is that many of these causes can be identified and addressed naturally. And when you target the underlying problem instead of just treating the symptom, meaningful improvements can happen surprisingly fast. In this video, I'll walk you through some of the most common but often ignored reasons blood pressure rises as we age. Once you understand what's really happening inside your body, you'll see why the usual advice doesn't always work, and what you can start doing today to support healthier blood pressure naturally. Let's start by understanding why focusing only on salt can be misleading. Here's how it works. Sodium raises your blood pressure by pulling extra water into your bloodstream, which increases your overall blood volume, and that increased volume raises the pressure inside your arteries. That part is true, but what almost nobody explains is what happens next in a healthy body. If your kidneys are working well, they sense that rise in pressure almost immediately. In response, they flush out the extra sodium and extra water through your urine. As that extra fluid volume comes down, your blood pressure comes back down right along with it. This system works remarkably well in healthy people. That's why some people can eat a lot of salty foods and never develop high blood pressure, while others are far more sensitive to it. This is called salt sensitivity, and it varies enormously from person to person. So here's the key insight. If your blood pressure stays high even after you've cut back on sodium, that tells you something important. The issue isn't the sodium itself, it's how your body is processing it. And that's where the real underlying causes start to show up. One of the first things I look at is magnesium. Magnesium plays a critical role in regulating your blood pressure. It boosts two important compounds, nitric oxide and prostacyclin, both of which help relax and widen your blood vessels. When magnesium levels are low, your blood vessels stay more constricted than they should, making it harder for blood to flow freely. And that's exactly what causes blood pressure to rise. Here's why this matters so much. Magnesium deficiency is incredibly common. Some estimates suggest that nearly half of the U.S. population doesn't get enough magnesium through their diet. And research backs this up. A large analysis combining 22 different studies found that people with lower magnesium levels had significantly higher odds of having high blood pressure. The lower the magnesium, the higher the risk. So why are so many people deficient all of a sudden? A big part of it comes down to our food. Refined grains, sugary foods, and heavily processed foods are stripped of many essential minerals, including magnesium. And eating a lot of sugar actually causes your body to lose magnesium through your urine, which makes the problem even worse. Here's something else worth knowing. Even if you're eating foods that should contain enough magnesium, you may still be falling short. Modern farming practices have pulled minerals out of the soil faster than they can be naturally replenished. The food looks the same, but it often contains noticeably less magnesium than it did just a few decades ago. So, what should you do about this? I'd still encourage prioritizing magnesium-rich foods, things like leafy greens, legumes, nuts, and dairy. But it's worth knowing that even a healthy diet today may give you less magnesium than it gave people a generation or two ago. For that reason, many people could genuinely benefit from a magnesium supplement, and this is absolutely something to bring up with your doctor if you have high blood pressure. There's a recent analysis combining 38 randomized controlled trials that found magnesium supplementation at a median dose of around 365 milligrams per day for 12 weeks produced small but meaningful reductions in both your top and bottom blood pressure numbers. and the effect was even more pronounced in people already taking blood pressure medication. In that group, magnesium supplementation was associated with nearly an 8-point drop in systolic blood pressure. Now let's talk about insulin because it's one of the most underappreciated players when it comes to blood pressure. When insulin levels are elevated, your kidneys start holding onto sodium. They essentially stop letting go. And as a result, your body retains both sodium and water, which causes your blood pressure to rise even if your sodium intake hasn't changed one bit. This is a big reason why people with insulin resistance, prediabetes, or type 2 diabetes so often end up with high blood pressure. And it's also why blood pressure frequently improves when insulin levels come down, sometimes even before someone loses any significant weight. This is exactly why cutting back on processed foods, refined carbohydrates, and added sugars can actually help your blood pressure even more than a low-salt diet alone. Salt might cause a temporary rise in blood pressure, but it's persistently elevated insulin levels that turn this into a long-term, chronic problem. This is also where fructose comes into play. Fructose is a simple sugar commonly used as a sweetener or preservative in many processed foods and drinks. When you consume a lot of fructose, your body produces more uric acid, and that's a major contributor to high blood pressure. High uric acid interferes with nitric oxide, which is what normally keeps your blood vessels relaxed. It also makes your blood vessels stiffer, and it makes it harder for your kidneys to get rid of sodium. Uric acid is actually one of the lab values I routinely check in my patients, especially those with high blood pressure. And I've seen many cases where blood pressure returns to normal simply by cutting back on fructose and bringing uric acid levels down. If diet changes alone aren't enough, there's a medication called allopurinol. Most people know it as a treatment for gout that can also help lower blood pressure when elevated uric acid is the underlying cause. But here's the bigger takeaway. Cutting out added sugars and processed foods helps with both insulin resistance and high uric acid at the same time. And it's pretty remarkable how addressing just these two factors can rapidly bring blood pressure down sometimes without needing typical blood pressure medications at all. This is a theme you'll keep seeing throughout this video. High blood pressure usually isn't caused by one single mistake. More often, it's the result of many small physiological stresses adding up together to create a much bigger problem. Another major piece of the puzzle that often gets overlooked is potassium. Potassium works in two main ways. First, in your blood vessels and kidneys, it helps your blood vessels relax, and it signals your kidneys to release extra sodium through urine. In other words, it directly counteracts sodium retention and helps lower the pressure inside your blood vessels. Second, potassium also has an effect in your brain. When potassium levels rise, particularly in the brain and cerebrospinal fluid, it helps calm down your sympathetic nervous system. That's your body's fight-or-flight response, the same system that raises blood pressure under stress. By calming that signal, potassium helps quiet your nervous system and reduces the hormones that would otherwise push your blood pressure up. Here's why this matters. The typical modern diet is very low in potassium and very high in sodium, exactly the opposite of what supports healthy blood pressure. This imbalance alone can raise your blood pressure, even if your total sodium intake doesn't seem particularly high. And when you combine low potassium with high insulin, high uric acid, and low magnesium, you've got a perfect storm, one that causes your body to hold on to sodium and keeps your blood pressure elevated over time. So, if you want to boost your potassium intake, some of my favorite foods include root vegetables like potatoes and sweet potatoes, vine fruits like tomatoes, cucumbers, and eggplant, leafy greens like spinach, and legumes like chickpeas, beans, and peas, which also give you a good dose of fiber. And here's a nice bonus. Many of these same foods are also rich in magnesium, so you get a double benefit from the same choices. Now, this isn't a complete list of everything that can affect blood pressure. We haven't touched on other important factors like vitamin D or B12 deficiencies, homocysteine levels, the impact of stress and sleep, or certain hormonal conditions, like a condition called primary aldosteronism, which actually shows up in anywhere from 8 to 20% of cases of blood pressure that's resistant to standard treatment. I'll be diving deeper into these topics in future videos. But for now, the key takeaway is this. It's important to address these underlying factors early before lasting damage to your blood vessels sets in. Because once that damage accumulates, once your blood vessels become stiff and lose their elasticity, high blood pressure becomes much harder to reverse. I hope this was helpful. Take care of yourself, and I'll see you in the next one.